hormone replacement therapy. It was a thing, then it stopped being a thing, and now it's a thing again. So in the grand tradition of mansplaining, this is On Second Thought. I think we can all agree that 2025 has been a shit year. For the historians watching this video hundreds of years in the future, right now, this is when everything started to go wrong. I'm very sorry. Now, by contrast, the 1990s were great. We saw the elimination of measles from North America, the end of the Cold War, the birth of the internet, and the rise of the Backstreet Boys. Life was pretty sweet. I mean, the only real wrinkle was that women were routinely prescribed hormones, and that turned out to be kind of a bad idea. Now, what we need to remember, and we need to get into the Wayback Machine for any of this to make sense, is that the 1990s medical establishment really did think that replacing estrogen in postmenopausal women was a good idea. And they thought that for reasons. Now, the reasoning went something like this. Woman has estrogen, woman is fine. Woman loses estrogen, woman has menopause. Menopause brings hot flashes, and heart disease and osteoporosis and several cancers and dementia and arthritis and weight gain and vaginal dryness and painful intercourse. A lot of bad stuff, okay? So give back estrogen, disease go away. The logic of it was pretty obvious, and it made a lot of sense to a lot of people. Now, true, it was based on observational studies, not on randomized controlled data, but don't get all high and mighty on me. If you were there, you would have done the same thing. But we have to remember something important. Some women were taking hormones to treat the symptoms of menopause. The hot flashes, the night sweats, the vasomotor symptoms, as we call them. But a lot of women were prescribed hormones for long-term disease prevention. They were healthy, presumably asymptomatic women taking hormones to prevent things like heart attacks and strokes and all that. Remember, because that's going to be important. Now, we fast forward a few years, and it's the 2000s. We dodge a bullet on Y2K, but a lot of other bad stuff started happening over the next few years. For our purposes, we're going to focus on 2002 and the publication of the Women's Health Initiative study, henceforth known as the WHI, because I'm trying to keep these videos to a tight 10. Now, the WHI study blew up the practice of prescribing hormones to women. The study is published, and hormones don't reduce cardiovascular disease as everybody thought they would. In fact, it increases the risk of heart disease and stroke and breast cancer and blood clots and does not reduce mortality. It was causing the very thing people were trying to prevent. And as you can imagine, everybody kind of lost their minds and hormone replacement therapy falls off a cliff. It was an extreme reaction, and in retrospect, a bit of an overcorrection. Because everybody rushed to get their patients off HRT because it wasn't preventing heart disease as expected, but they forgot that it was still very good at treating menopausal symptoms. They kind of threw out the baby with the bathwater, and it became bad for everyone. Now, 20 some odd years later, people look back at the WHI study and, they can point out some of the problems. Now, some of the main criticisms of the WHI were the women were about a decade too old. The women in the study had an average age of 63, whereas the average age of menopause is 51. And while this is a common criticism, you have to remember what the WHI study was trying to prove or disprove. The point of WHI was to test whether HRT could prevent cardiovascular disease, so they wanted an older, higher-risk population to improve the power of the study. It was a choice, and an understandable one, but it does mean that the study is not reflective of most women who are going through menopause. Also, the risk of more heart attacks, strokes, blood clots, and all that was mainly seen in the group of women who got estrogen plus progesterone. The women who just got estrogen didn't really show an increased risk, or a very minimal one. But you have to give progesterone to women with an intact uterus. Unopposed estrogen increases the risk of uterine cancer. So only the women in WHI who had a hysterectomy got just estrogen, and you can't really do much about that. But the real problem with WHI, you guessed it, it's mathematical. So let's dig in. Now, for illustrative purposes, I'm using the numbers from the estrogen plus progesterone group from the original 2002 publication. The numbers are going to be a little bit different if you look at the later follow-up studies, but the points are basically the same. The authors reported hazard ratios of 1.29 for heart disease, 1.26 for breast cancer, 1.41 for stroke, 2.13 for pulmonary embolism, and 1.22 for total cardiovascular disease. And so many people looked at this and said, hazard ratio is greater than 1, confidence interval doesn't cross 0, p-value of less than 0.05, hormones bad, moving on. But if we look at the stuff on the absolute scale, it's a bit more nuanced. In absolute risk, hormones caused 7 extra heart attacks, 8 extra strokes, 8 extra breast cancers, and 18 extra blood clots. And sure, there were 6 fewer colorectal cancers and 5 fewer hip fractures, but we have colonoscopies and bisphosphonates for those. So overall, it was a negative. But that's 7 heart attacks, 8 strokes, 8 breast cancers, and 18 blood clots per 10,000 women per year. The individual risk per woman per year was very small. It's not zero, obviously, and it's not useful for cardiovascular prevention. That's pretty clear. But if you're using hormones to treat menopausal symptoms, like the vasomotor symptoms of hot flashes and night sweats and all that, I think you can say it's fairly safe unless you have a baseline high risk. I wouldn't give it to someone with a strong family history of breast cancer or a thrombophilia or a recent heart attack or stroke. But for a low risk, average risk woman, it's not no risk, but it's low enough that it's probably worth it to achieve the symptomatic relief of what can be very debilitating symptoms. And the symptoms of menopause can be very debilitating. Most women don't end up seeking medical attention and end up suffering in silence. So the rise and fall and rise again of menopausal hormone therapy illustrates a funny paradox. The risks to the population can be significant. If you start giving a lot of women hormones unnecessarily, you're going to cause a lot of extra heart attacks and strokes and blood clots. But the risk to an individual woman is pretty low. So would I prescribe hormones to a woman who had menopausal symptoms? Yes. I actually get this consult all the time. If she has no contraindications or high-risk features or family history, yeah, I would have no problem starting the therapy to treat the symptoms. But you probably shouldn't continue it lifelong like we used to. You continue it for as long as the symptoms of menopause last. Now, that can be 5 years or 10 years for many women, and in fact, for some, it can be up to 20 years. But the point is you're treating symptoms, not preventing disease. You use it for as long as you need to. And if you want to try non-hormonal alternatives like low-dose SSRIs or some of the new therapies like elizinitant or fezolinetant, then you give that a try. Menopausal hormone therapy, we're not supposed to call it HRT anymore, is exactly what it says it is. It's therapy. It treats the symptoms of menopause. It's not for prevention. Use it if you need it. Stop it when you don't. Overall, the risks are low for more low-risk women. It took almost 30 years to sort this out, but I think we got there. For Medscape, I'm Christopher Labos.